At the moment, Kenyans pay a maximum of 1,700 shillings every month, but now that is being opened up. If you have a salary of 1 million shillings gross pay, then that will mean that you'll pay 27,500 shillings to the NHIF. Mheshimiwa Yusuf Hassan, let me begin with you on this one, because, I mean, Kenyans are preparing for the new realities because, first of all, the coming into effect of the housing levy, it will mean that 1.5% of your salary will go into the housing levy. And it's actually of gross pay, so it's that significant. But then also, are you satisfied that NHIF rate should get to that level, 2.75%, without a cap to facilitate universal health coverage and the social equality in the country?
Yes, I think, first of all, universal health coverage is important. And as a country, we really need to be able to provide adequate quality health care to all our citizens. And I can speak as a former victim of the high cost of medical care in our country. The cost of medical care in our country is crippling. For example, when I was injured in a bomb explosion, I spent a considerable amount of my income and my savings to treat myself. Unfortunately, I had the ability, I had the means to be able to do that.
Right.
But for millions of Kenyans, there's simply no such an ability. And it is important for the state to intervene, provide some kind of medical care that we can get in the country. And the other thing is that people spend billions of shillings in medical care outside the country,
right.
In India, for example. And many families are completely bankrupted by the cost of medical care. So I think it is important to have a national health insurance fund that is adequate, that is effective, and can provide quality medical care inside our country. And I support this particular move in the sense that the previous payments were simply not sufficient to provide that kind of, although you are collecting money, it was simply not sufficient to be able to provide the coverage that we need. And so I think in the long term, it may impact the pocket of any salaried person,
right.
But it is necessary. And I like also the idea that, in fact, they're increasing contributions for the rich. You know, society can only be transformed if you have a responsibility in which the rich are able to be taxed or can contribute more to support the disadvantaged, so that we have a balance in our country and we are able to have a more equitable society.
Who is rich according to you?
Anyone who is earning a salary is able to and can afford
contribute in accordance.
Yeah, can contribute according to their capability, according to their income. And in particular, people who are earning above 100,000 to a million can afford to pay the small percentage that has been demanded of them to support the program. So I fully support it in that sense. And I think in the long term, look at the National Health Service in Britain. You know, by global standards now, Britain is not a wealthy country. Britain used to be a very wealthy country. But the only thing that they have kept going and provided free of charge through their own contribution is through the National Health Service. Many of the European countries have got that universal coverage. Denmark, Norway, Sweden. They're able to provide for their citizens, although their economies are not big as the United States, China, or any of those other, or Japan. So I think there's nobody else who is going to do it for us.
Okay.
We have to pay for our universal health coverage. We have to pay for our education. We have to pay for our other social protections for highly vulnerable people in our community. And to be honest, there's a lot of emphasis on the inability. We can't do this, we can't do. You can also say that maybe we don't deserve to be independent and to have the freedoms that we have.
Okay.
We have to pay for those.